Stay with us. Arthritis doesn't only affect adults, it affects children as well. And with us is one of the state's few pediatric rheumatologists, Dr. Renee Modica with the University of Florida Department of Pediatrics. Dr. Modica, thanks for being with us.
Thank you for having me.
What is perhaps the biggest misconception about arthritis in children?
I think the thing that people don't realize is that children actually get arthritis. It's always considered an elderly person's condition, but children get the form of arthritis that's autoimmune, where your immune system gets confused and thinks parts of your body aren't supposed to be there. And in the case of juvenile arthritis, it's the joints. So the immune system actually attacks the joints. And the biggest misconception about it is, I think, recognizing that it's there. Mm-hmm. Children often won't complain about pain. Instead, they'll compensate by avoiding activities that they like to do. And what makes it challenging in pediatrics is that children tend to still do what they love, but they'll just do it a different way. So it takes a very astute parent or caregiver or school teacher to recognize that. And the other thing is that makes it a little bit more complicated is that this is in a developing child, so children from the age of infancy anywhere till 21 years of age can get arthritis. So if you have a child who's developing along the way, you may not recognize if they're just crawling, they may get thought to be developmentally delayed with a neurologic problem as opposed to an arthritic problem.
So how do you tell parents to spot the differences between what may be, as you say, a developmental delay and arthritis? What do parents need to look for?
Well, the joint swelling that occurs is usually a later finding. Morning stiffness is probably a more reliable sign, actually, because this is an inflammatory arthritis that the immune system is causing. The joints get stiff when people sleep on them overnight or when they have prolonged periods of inactivity. So morning stiffness is a more common first sign of arthritis as opposed to pain. Probably the second thing would be compensating their activities. So they might notice a limp. They might notice that they will avoid doing, the playground, or if the child is involved in sports, they may adapt how they're playing their position. So just being a keen observer of those things.
And so if your child complains of aches over and over and over again, and it's the same kind of thing.
Right. Well, the chronicity of it. This isn't, my joints just hurt after, I did a rough activity. It's the fact that that this is a chronic problem, and the inflammation caused by the autoimmune dysregulation doesn't go away on its own. So the fact that they are complaining of or altering their activities on a daily basis for several weeks or months would be different from the child who just is carrying a heavy backpack or, has a sports-related injury.
How do you treat a child with arthritis differently than you do an adult with arthritis, or do you?
Well, surprisingly enough, we use a lot of the same medications because the basic problem is the immune system's confused and thinks the joints aren't supposed to be there. So,
when you say that the immune system thinks the joints aren't supposed to be there. So what does the immune system do if it thinks a joint isn't supposed to be there?
Well, we don't really know. I mean, the immune system is supposed to protect your body from infection, cancer, things that aren't supposed to be there, things that aren't self. In the cases of arthritis, it almost forgets that the joints are part of yourself.
So it starts attacking.
Yeah, it attacks the lining of the joint, which is a biologically active membrane. It makes all the nourishment that the joint needs to function, and it makes it supersized, essentially.
Okay.
And so that's where you get all the excessive fluid and the extra tissue there. But it also makes a lot of these inflammation proteins, that there are several types, and over time, researchers have gotten very skilled at targeting different inflammatory proteins that are involved in this process. So those are the medications that we actually use to treat this.
Once a child is diagnosed with juvenile arthritis, does it necessarily mean that the rest of his or her life is going to be spent in pain or limited movement?
That's a great question, and it's a question that I think is the hardest to answer for families who have this diagnosis. We don't have the crystal ball to tell us which patients are going to go in remission versus those who are going to have a chronically, active course. And there are certain subtypes of arthritis. I like to tell families that arthritis comes in many flavors. And each one of those subtypes of arthritis has certain prognostic indicators, meaning certain lab tests that might make it more severe or less severe. But really, the other reason why that's a hard question to answer is because the medications that we have are better and better. So in the past, we weren't as hopeful as we are now, but thanks to, the Arthritis Foundation and other funding agencies that have allowed researchers to develop these new medications, we're more hopeful about people recovering from this.
It's the youngest patient you've ever treated with juvenile arthritis?
3 months.
3 months. And how did you know that a 3-month-old had arthritis?
Well, they basically, there are arthritis outside of the typical juvenile idiopathic arthritis that we've been talking about. There's arthritis associated with other autoimmune conditions that have a genetic predisposition.
Okay.
So they present much younger. But for the juvenile idiopathic arthritis, probably, infancy would be the youngest.
Okay. And so as the research is going, does that give you hope as a pediatric rheumatologist?
Absolutely. I mean, it's a really great time to be a rheumatologist in the sense that we are able to instill much more hope to these families, and we have much more medications than we've had in the past. So it's been, I feel very hopeful, actually. So
we're going to let that smile also signal hope for families who may have children who are dealing with arthritis. Dr. Modica, thank you for being with us. And we also have to point out that you, along with being at the University of Florida, you are also at Shands as well. So you're a busy lady.
Yeah.
Thanks for being with us.
Thank you for having me on the show. I appreciate it.
When we come back, we're going to meet a mother and daughter who are dealing with arthritis every day. Don't go away.